Good evening, everyone. Thank you for joining us tonight. Welcome to the Avexia webinar series. Our topic for tonight is Introduction to Metaflammation and the Progression of Gut Incompetency to Evolving Food Reactivity, Part 1 in a three-part series on food allergies and sensitivities. My name is Christopher Chu. I'm the Director of Marketing for Avexia Diagnostics and will be your host for this evening. Today, I have the distinct pleasure of being joined by our guest, Dr. James LaValle, who will be our presenter for this webinar. Dr. LaValle is a clinical pharmacist and board-certified clinical nutritionist with over 30 years of experience in wellness, prevention, and disease state management. In addition, he has written 19 books, 200 plus articles, and 3 databases. His most recent book, Your Blood Never Lies, was released in 2013. Dr. LaValle's book, Cracking the Metabolic Code, released in 2004, was a breakthrough publication in understanding overall metabolic function. Dr. LaValle taught for 15 years as an appointed adjunct faculty member at the University of Cincinnati College of Pharmacy. Dr. LaValle is the founder of Metabolic Code Enterprises, a cloud-based assessment tool. In addition, he was named one of the 50 most influential pharmacists by American Druggist magazine and was one of 9 Americans selected by Senator Tom Harkin to participate in the inaugural Dietary Supplement Education Alliance and Dietary Supplement Information Bureau. Joining Dr. LaValle tonight will be Dr. Wayne Sedano, our Director of Clinical Support and Education at Avexia Diagnostics. Additionally, Dr. Sedano is the Director of Integrative Medicine Education for the College of Integrative Medicine and lectures and teaches internationally. Before we begin, just a bit of housekeeping. We encourage participation, so if you have a question, you may submit your questions in the questions field in the right hand of the interface. We will answer submitted questions towards the end of the presentation. If your questions are not answered this evening, you will surely receive an answer by email within a day or two. Typically, most of our presentations run about 50 minutes. However, tonight's presentation is packed with clinical pearls like the importance of immunoglobulin IgG4 and the importance of histamine testing as it relates to food allergy, food sensitivity, and food intolerance. So get yourself a warm cup of your herbal tea and enjoy this amazing presentation. Without further delay, I will now turn the webinar over to Dr. LaValle.
Thank you, Christopher. It's great to be here, and I'm excited about us spending a little bit of time together and talk about the importance, and I think it's the emerging importance of food intolerance and sensitivity testing, as well as with food allergies, because we've had so much duress on the immune systems of all of our patients and for ourselves over the last 3 years. And I think we'll find that food allergies and sensitivities are going to play a much bigger role in the next few years as we're kind of coming out of the pandemic. So take a look. All right. So, how do food allergies and sensitivities occur? What do they what to test for and why? We're going to go through that tonight. That's going to be the basics for our discussion. And of course, and I know these are the basic terms, but I do want us to, just kind of review that, what is an allergy? It's a hypersensitivity reaction, of course, mediated by an immunologic mechanism to a certain food. We talk about what is a food allergy. It can be antibody or cell mediated. The typical antibody responses for in allergies is IgE. Of course, there's, environmental allergies as well. And there can also be intolerances to foods. And it's thought that about 15 million people suffer from a true IgE food allergy response in the US. And strikingly, and this really didn't surprise me that this was reported in Ailments in Pharmacology Therapeutics, 15 to 20% report an IgG-mediated food intolerance. I mean, think about it. How many people that you've treated or that you've realized came in and said, gee, almonds never used to bother me, but now I drink almond milk and get a rash. It's not just about gluten and dairy, right? It's about the fact that as our guts are breaking down more due to the duresses of the gut, which we're going to go through, we start to become more intolerant. So I think we're going to see these statistics go up more and more. So when you look globally, about 20% of the population alter their daily diet due to a perceived adverse food reaction. And remember, this is Center for Disease Control, 2021. So this is, it's starting to become aware. If you read about IgG mediated sensitivities, pulled, information from 15 years ago, got kind of poo-pooed, right? IgG4, what are you talking about? There's nothing but an IgE allergic response. These other ones don't mean that much. Well, now we're finding out that they mean, actually, they're quite significant, and they mean a lot more than we previously thought. So, what's the big difference when we look at this? Food sensitivities can occur at any age, and in this particular slide, it was thought that up to 45% of people may suffer from a food sensitivity. And remember, the big difference between a sensitivity and a food allergy is that typically it may take longer for it to occur. So somebody eats, a gluten-containing grain, or maybe they have an allergy to cow's dairy, or maybe they have an allergy to almond, or whatever it is, and they maybe get inflammation or joint aches, and it takes a period of time for it to fully evolve. Typically not life-threatening. There's a lot of different causes to it, and really virtually any food can become a food sensitivity. So even though on the slide they show corn and eggs and sugar and sesame and soy and wheat and dairy, and environmental triggers, of course, SIRS being a whole other category we won't get through, but certainly we're going to talk about that in the next part of the series because of the immune system shift that occurs in people with chronic inflammatory response syndrome, and therefore they create more C3 complement reactions, right? So we're going to get to that later. You have to tune in for the next talk on that one. So virtually any food, and then food allergies really develop from infancy, and they're severe and life-threatening. So, and I always tell people, yes, if you want to try and do a vitamin C flush or quercetin, because that's all you've got, that's great, but call 911, have your EpiPen, be ready to correct for that tightening airway. And obviously tree nuts, certain shellfish, some food additives, milk is big, as we said, other fish, stinging insects, some medications, right? So people can have sulfa allergy, penicillin allergy. But this is a case, of course, where they have a sudden response. And where does it really begin? Well, this is our big challenge these days, right? We have so many people that are either under a lot of stress, and of course, stress causes the tight junctions to get loosened up because of the increase in interleukin 6. As IL-6 gets upregulated, you upregulate claudin 2, and that makes the tight junctions get unstable. And now all of a sudden, things are slipping through the epithelial cells of the intestine. And it can be drug therapy that does this. It could be a diet that ends up being high in circulating endotoxin, right? A lot of lipopolysaccharide will kind of start to destabilize the epithelial cells. So any number of things can destabilize the epithelial cells. The issue is that the allergen gets through. And when we say allergen, it's any material that you could become allergic to, right? So whether it's a pollen or peanuts or guacamole, meaning avocado, right? Or tomatoes, right? You get the antigen presenting cell gets triggered by the allergen. That then upregulates the Th2 cells, which will upregulate cytokines and then create B cell activation, which then creates the IgE epitope. And then the next time that the allergen hits, right, you get mast cell degranulation, you get histamines, leukotrienes, and inflammatory cytokines that get released. And then, of course, the increase in eosinophils as well. So in the end, our culture of lots of antibiotics, oral contraceptives, proton pump inhibitors, H2 blockers, even medications like metformin or statins are shown to disrupt the microbiome, which could affect the epithelium, right? Lots of different drugs that can have this effect can then eventually lead to this impact on developing allergies or sensitivities with food. Obviously, we now know that when we give probiotics to neonates in a neonatal state in the third trimester, that they're much less sensitive, or they are much less likely to develop IgE food allergies. And so, what's the thing that's driving this in early life? Antibiotics, children that are eating foods that they may be sensitive to or intolerant to. It could be exposures that the child has, starts to develop a disruption in that microbiome, and that microbiome alteration then develops, developing food allergies. And of course, as you look at that, you see the progression goes to IgE specific pro-inflammatory cytokines, inhibits T regulatory cells, suppresses tolerogenic CD103 in cells. But the reality to this is that we all have heard this now, right? It's allergies, eczema, asthma, autoimmunity, right? So the more we can understand that as people are moving through their life from their neonatal state, right, from before the time they were born to the current time they're at, they're loading metabolic inflammatory signals. And the reason that metaflammation is so important is that metaflammation leads to increased inflammaging. So it's one thing if you're 6, it's another thing if you're 36 and your gut is breaking down and you're reacting to these foods and you're starting to trigger these very significant inflammatory compounds. So when we look at testing, IgE, of course, the antibody responsible at least to an allergic reaction, typically can occur immediately, on immediate contact, but it could also be typically even within 1 to 3 hours. And the signs of that, typically atopic dermatitis, allergies, eczema, wheezing, asthma, runny nose, itching, headaches, nasal congestion, shortness of breath. All of those things can occur with IgE. And of course, with IgG, that's delayed reaction, which I already talked about. More problematic for IgG is the fact that it triggers low-grade inflammation over time. So it creates that 72-hour wave of allergic reactions that's increasing inflammatory cytokines and allergic response. What we're going to talk about tonight is the IgG4 and the C3BD complement. So IgG4 is the complement to IgE. And what it basically does is it creates an epitope that the reaction will occur with, so that IgE is minimized. So the one thing you want to keep in mind is if you see people with high levels of IgG4, that means they're queuing that reaction up in a big way, and the fact that it can lead to chronic inflammatory responses. And now IgG4 is directly associated with developing autoimmunity. So there's a lot of studies that are coming out now that are looking at IgG4. So why do we measure IgG4? Because we're measuring to understand what blocking potential is there for IgE, but more importantly, if you're like me, I have a lot of patients with autoimmunity. And if I can find out if people are reacting to the specific immunoglobulin, IgG4, that's going to help me to reduce that autoimmune driven behavior. So IgG4 in the literature contributes to eosinophilic esophagitis, inflammation and triggering for thyroid tissues, ovarian tissues, and prostate tissues. And then it's C3BD, which is at the bottom here, and I'm not quite sure why that was CFP. That should be C3BD, which we'll get to here. That's the complement to IgG sensitivity. So you have IgG4 is the complement to IgE. C3, B, and D, which is just kind of two subsets of C3, it is the complement to an IgG response. And if you have a C3BD response, that means you have about a 10,000 times stronger IgG reaction than just IgG alone. Now, it's interesting because when they looked at, for example, in individuals with COVID, and I'm just bringing this up because we noticed that more people were testing for C3BD sensitivities since the pandemic. One of the things that got upregulated, and if you read on the immunologic drive in COVID long haulers, for example, it's called the C31QA complement path, and it's triggering some associated complement pathways, and so we're seeing more C3 reactions when we test with food. So on IgG4, if you look at this, I mean, I kind of already hit a lot of this, that it inhibits more serious IgE reactions. That's the value of IgG4. It competes with IgE at the same epitope site. It's called a blocking antibody. So, this is something that, a relatively short time ago, you wouldn't have really heard about this, even though this was a study this was a paper published in 2004. But we really just haven't seen the value to it until recently. And so, when you think of the complement cascade or part of the innate immune system that enhances that function of antibodies and phagocytosis, mild and moderate levels of IgG4 actually have a protective effect, and that's okay. But when you have high levels of IgG4, that is what leads to those IgG-related disease or IgG-related initiation of autoimmune pathways. And I've already, and so if you take anything away from tonight, if you're not testing to look for IgG4 or C3BD dietary antigens, you're missing a big piece of the complete puzzle of how a person might be reacting to a food. So this is conditions that IgG4 has been associated with. If you look at thyroid disease, lung disease, pharyngitis, pancreatitis, prostatitis. I actually have another slide that even has more conditions and diseases associated with it. Chronic fibroinflammatory conditions. So think about it. How often do you see people with even connective tissue issues that get much better when you put them on an elimination diet, right? It's because you're cutting down this autoimmune epitope. So when you look at this, IgG4 levels will really help you to either rule out or confirm an intolerance as a cause of symptoms. So the higher the IgG4, the more likely your intolerance reactions are real. And when you look at this C3 amplifier, so remember, when C3 gets upregulated, it pushes that Th2 side of your immune system, which is IL-6, other inflammatory cytokines that are driving chronic meta-inflammatory effects. And so what basically happens is that when that gets revved up enough and that C3 complement pathway gets upregulated, it keeps the cascade on high alert. So you're more prone to create a more significant reaction. And then so there's this convergence then, with this C3 complement path of all these activation pathways, and that is what amplifies the complement response. So what it's supposed to be doing, C3 should be coordinating your downstream immune response. The problem is that if C3 gets overwhelmed, you then start to create this out of control inflammatory response. Hence, what went on, one of the aspects on the complement pathway, what went on with the pandemic and cytokine storms, was the lack of the C3 pathway being able to regulate, and that upregulation of the C3-1AQ path. So this is just kind of a quick development of that signaling, right? You've got danger signals, microbes. There's this danger sensing at the C1Q path, which then starts to trigger these immune sensors, C3, C2, and C4, which then leads to this complement path activation, or activation of the complement receptors that occur at the cellular level. And so C3, C3BD, and then So you think, well, okay, is this legit or not? So this was the differential diagnosis in food intolerance, continuing medical education. If you look here, the type 2 complement factors are actually now really being recognized and discussed as a part of the allergic signaling process in individuals. So, really understanding this, these different categories is incredibly important. So I'm going to show you a test. This is an infinite food allergy test. And what I like about this test, of course, is that it makes it easy to see how a person's reacting. So if you notice, you have IgE, IgG4, IgG, and of course the last C3, B, and D. And obviously red is hot. I put a lot more weight on things when their C3BD and the IgG4 are activated. And of course you have to be careful about IgE. But if you notice, it's just a very simple format. In a few pages, you get a lot of information that you're able to go over, and it makes it fairly easy to be able to explain to the patient, like, look, you have autoimmunity. You see all these IgG4s? These are super important for you to eliminate. And of course, depending on what's going on for the individual, you may have them eliminate all of the foods that even light up in yellow, and that's what this is. So after we get through here and you're looking at different tests, if you look at wheat here, see how it lit up almost everything in this individual. Cow's milk lit up almost everything in this individual. And so these are long-standing, long-driving immunologic reactions that are going on in these individuals. When you see these across all 4 categories, they're major disruptors to their immune system. And so what you end up with is a list. And the list goes one of 2 ways. One, it can be, I just want general health. I want to know about my food allergies. I don't have a real big issue, but maybe my gut's off a little and I'm gaining weight. And so you could give them the shorter list. And then the more severe the symptoms that you're dealing with, the more severe the condition or the situation that someone's in, you give them, the longer list. So there's 2 lists: mild restriction, severe restriction. Mild restriction is when it's either patients with less severe symptoms or they're just interested in it from a prevention perspective, whereas the more severe symptoms are people with rheumatoid arthritis, lupus, colitis, anything like that, where we're really concerned about getting that inflammatory signaling and really a multifocal inflammatory signal, what's going on in the gut, getting that to be stamped down. So, what causes a food allergy? We kind of went through this a little bit already, but this is a really nice picture for it. That, we have these epithelial cells, and yes, infection will cause those epithelial cells to break down. The tight junctions will break down. Stress is one of the biggest things that cause it. So if you have people that are coming in, you saying, I'm anxious, and think about it. How many women with IBS also have anxiety, right? About a 35% crossover rate. If you have got people that are coming in complaining of, oh, I'm anxious, I'm overcommitted, I can't sleep at night, I perseverate, I'm stressed out, and then they're complaining about their gut, you might get their gut to feel a little bit better, meaning that give them probiotics, give them something to help knock out unfriendly flora. Maybe you do a GI test, look at their stool, and you see they got bad bugs in 3 different areas, right? Their calprotectin is elevated, whatever, right? You will fight that food allergy panel forever if you don't work on getting the person to calm down and get out of their sympathetic overdrive, because they'll continually be signaling basically the gut lining is going to be breaking down. So another clinical pearl is when you're working with people with food allergen sensitivities, really check in on their levels of stress. What's their blood pressure? What's their resting heart rate? Do they feel like they're overcommitted in their life? Do they feel anxious? Do they have food cravings? They perseverating at night, have to make, they running through their day's end and can't go to sleep? Are they waking up in the middle of the night? All of those things are telling us, uh-oh, there's pressure on the gut. All right. And so in a leaky gut, of course, you get, food particles to react. So you'll get antibodies, they'll move through into the bloodstream. And then we start getting more and more significant reactions as we have this leakiness of the gut and these compounds that are getting through and then triggering a more systemic event. And this is a beautiful picture. I love this picture because you look at the left, and you see a healthy gut epithelial tissue lining, right? This is a healthy tight junctions and fully competent gut. And here, if you look below it, are the cilia, right? And the integrity of the gut's intact, right? Hardly any spaces. Now let's look over at the left. So when we have a gut that looks like C and D, meaning that there's cracks and crevices, and by the way, if the person's tongue is looking cracked and crevice, probably their microbiome, their intestine is probably cracked and crevice. But this is that picture of that leaky gut, right? See, we're now, think about it, lectins and proteins and all kinds of things can get in there and you can start to get reactive to. And if you look here at once again at the cilia, right, the brush border, look at the gaps that are in these cells. So this is what we're trying to realize, that when people are like this over at CD, they're going to be likely to have a breakdown in the competency of how they respond to food. And you know what? With glyphosates and toxic metals and all the antibiotics people are on and the acid blocking meds, all the different things that can influence their gut, I think we have more people sitting around on the CD side than the AB side. And this is interesting here, right? This was microbiota dysbiosis and biliary dysfunction and inflammatory bowel disease and colorectal cancers, exploring a common ground hypothesis. So I think we're finally really starting to understand that when I started talking about leaky gut back in 1986, wasn't a lot of literature, and I learned about it from my mentor. But now there's a ton of literature and there's pictures. So we can show patients a picture of this is what it looks like. Gut microbiome alterations and gut barrier dysfunction associated with host immune homeostasis in COVID-19 patients. The reason I brought this up is that you have a lot of COVID long haulers, and you need to look for the signs that they may be in a compromised immunologic position. So testing for foods makes sense, and it will help them to calm down their immunoreactivity. And then, of course, you can measure lipopolysaccharide, you can measure histamine, you can measure zonulin. There's a lot of different things that you can measure to also find out if the individuals that that got exposed to COVID, what's their long-term intestinal fortitude and capacity. Because in the end, when the gut's gone and you're having these kind of reactions, you're losing metabolic reserve, metabolic durability, and metabolic capacity. And I know somebody's going to ask me during the presentation, does this happen with vaccines? Well, I haven't seen any studies that show it. But obviously there's a side effect profile, just like there's with all drugs that are happening with the vaccines. And then in addition to that, we do see, so if you start doing testing, when people are, they do recently get vaccinated, there does seem to be an uptick in that C3BD test. And that's just a clinical observation. So I'm not making any kind of statement one way or the other. So metabolism, when we talk about your metabolism, all about the fact that it's directly underlying the global metabolic inflammatory signaling. The more inflamed you are, the more your gut breaks down. The more your guts broke down, the more inflamed you'll get. Metabolic inflammation drives metabolic disruption, and disruption of metabolic performance. That leads to strategies that you're able to cut off excessive inflammatory signaling. So why am I talking about metaflammation? Well, it's simple. If even because the big knock, I think, and for the long food, accurate is it 10% off. I'd rather know 90% that I'm reacting to and dip out of that bucket of inflammatory signaling that I have. Now, that being said, infant allergy labs, 99% reproducibility, virtually 100% sensitivity, very accurate, right? But why are food allergies so important today? Because the gut is at the epicenter of our people's health. We realize that. And we can't just say it's about the microbiome. And no, just putting in microbiome isn't going to re-regulate all this. We got to actively work at restoring gut integrity. There's a lot of different things that go into that, right? Hormonal balance, stress hormones, as I already talked about. Obviously, if glucose is high and insulin regulation is off, you start to reduce blood flow to the gut. And when you reduce blood flow to the gut due to blood pressure going up, now I start to create more die-off in my bacteria, which is going to release more lipopolysaccharides, circulating endotoxin, in other words, and that's going to trigger a lot of inflammatory signaling, right? So that's the thing to keep in mind, is that the gut really becomes a very important aspect. And I know we're going to go through a 3-part series on this, so we're going to dive into it in a big way. But when you think of the construct of metaflammation, the gut's in the middle of this. So we'll take a look at this. This is back in 2008, actually the first article that termed that metaflammation construct. So if you think of this, take a look. Smoking, starvation, overnutrition. So undernutrition, overnutrition. And yeah, I got everybody. I'm doing 16/8, 7 days a week. Look at your lab panels, see how you're doing with that, because it may be that going 16/8 may just be a little bit too much for some people. I know for me, when I'm looking at labs on people, I don't mind them doing it a couple days a week, maybe even fasting a day a week, but in general, I try to keep them around 14/10 or 12/12. And there's some evidence in the literature that would support that. Excessive alcohol intake, get them wearing a Whoop band or an Oura ring so that they can see what alcohol is doing to their sleep, and maybe that'll convince them to cut down, right? And then diet. And there is no one diet that works for everybody, guys. I mean, yes, people should be plant forward. I think that's safe. Other than that, there's probably some variations on the theme. But in general, people eat too much, they eat too often, they eat too late, they pick the wrong foods, they don't get enough sleep, and they're stressed out. And of course, their gut's breaking down before we get into pollution and environmental burden, and then over exercise, which is now a problem, right? So we get into runner's diarrhea. Why did that occur? Well, because you kept running and triggering cortisol and triggering inflammatory cytokines, and eventually you triggered an inflammatory response in your gut. And so people that overtrain start creating more histamine response, hence reactive airway. They start to create more sensitivity in their gut, all leading to metaflammation, which is a major issue, of course, in developing chronic non-communicable degenerative diseases, right? So food clearly sits in the middle of this. And this is just kind of understanding that when you're metabolically inflamed, a lot of bad things happen. So the reason I wanted to bring up metaflammation tonight is the fact that people say, oh, I don't know if I'm allergic to food. Well, wouldn't you want to know if you're eating foods that's triggering metabolic inflammation? Because look at this. This is what all of us are seeing and dealing with our patients. So you've got a stimuli, right? It could be damaged cell debris. I'm not going into autophagy because I'm eating all the time. Maybe there's an irritant chemical, environmental burden, pesticides, solvents, whatever, right? Pathogens. There could be so any kind of biotoxin or parasite, you name it, right? Or intrinsic cell defect, right? Some kind of genetic issue with detoxification. But in addition to that, we see that your body is supposed to trigger an inflammatory response. That's good. We're supposed to have an inflammatory response, but it's supposed to turn off. So so effectively, it eliminates the cause of the inflammation. It switches off the inflammation and return to a homeostatic state. That was all of Reckwig's stuff. If any of you are familiar with Reckwig's writings in homotoxicology back in the 60s, or if you want to look at matrix regulation according to Kissinger, all of it's about this: inflammation on due to a trauma or some sort of signal, and then it turns it off. Now, the problem is when we stay in a chronic inflamed state, what starts to happen? So just imagine if you're eating foods you're intolerant to, and you're triggering more histamine, you're triggering more inflammatory cytokines. or maybe it's that you're overtraining, or maybe that you're exposed to something, or maybe it's that you're stressed out, right? But the systemic effect is clear. One, which isn't on this slide, and this was National Revisions of Cardiology 2018. They didn't, which I was surprised they didn't put this in here, dyslipidemia. You get more ox-LDL, more small particle LDL, more apolipoprotein B expression, more LPA expression, more myeloperoxidase, more fibrinogen, more clotting factor. All of those things occur under chronic inflammation. And I think all of us understand that. But a couple other things that happen. You start to lose IGF-1 signaling and production. Now, we hear, oh, it's better to have low IGF-1. No, it's better to have regulated IGF-1. You need IGF-1. You just don't need too much, and you certainly don't want not enough. And that's kind of the big argument that everybody's kind of polarizing over right now, kind of in the longevity space. And then, of course, you lose dynamic muscle perfusion. The next piece that happens is you start to see more people with low ferritin and either normal, sometimes high, but high iron, low ferritin, low iron, low ferritin, and they just don't seem to be absorbing well. Well, it's really because you've turned off your ability to make ferritin. So under chronic inflammatory signaling, you downregulate ferroportin, you reduce iron absorption and recycling, and you reduce EPO signaling. The other things that are important is that you begin to get insulin resistance. So are food allergies associated with weight gain? Yes, we're going to go over that in another talk. So why is it that way? Because as we're chronically metabolically inflamed, we trigger TNF alpha, we trigger interleukin 6. It alters insulin receptor signaling, both the IRS1 and IRS2 activation. Well, what's the big deal about that? Well, you're gonna become, you're gonna go into aerobic glycolysis, right? 2 packets of energy for every packet of glucose it goes through, instead of 38 packets of energy, right? So you get tired, and you start to become metabolically inefficient. Your metabolism starts to shut down, and you start storing fat, and you start getting adipose tissue, and of course, adipose tissue releases adipokines, which furthers that inflammatory signaling. You get bone loss, because TNF alpha and IL-1 beta and IL-6 upregulate osteoclast, downregulate osteocalcin. More importantly, we see a decrease in neurogenesis, meaning that we have less cell plasticity, and of course, under inflammation signaling that's chronically occurring, we start to see the inhibition of stem cells in the brain being able to produce fully matured neurons that are dendritically pruned, right? You get inhibited from those stem cell-like cells moving to progenitor cells and then growing over a 2 to 4 week period. That gets inhibited. And the last piece to this is that you get mitochondrial function downregulation. So if you look, you get TNF alpha, IL-1 beta, IL-6 downregulates ATP. You get this NAD to NADH ratio go down, which everybody knows about now, right? And then, of course, PGC1 alpha gets downregulated, which decreases your mitochondrial capacity and your hormone signaling and your neurotransmitter signaling. PGC1 alpha, pretty important compound. And so the next piece to this is, it's also stress. So yes, we have all this inflammation piece, but people get under what's called allostatic load. And why is allostatic load so important? Because the more we trigger allostatic load, the more our gut gets leakier via the enteric nervous system. And so when we think of this, that gut immune brain interface, it's about filtering defense and repair. It's about the brain being at the command and control. And when this is good, it's organized and secure. And when it's not, it's disordered and unpredictable, meaning think about people who are stressed out, anxious, and have irritable bowel. They have IBS or IBD. What's the first thing they do when they're looking around when they go into a store? They're looking for a bathroom because they know there could be an emergency, right? So they're not really secure or organized. They're always waiting for that signal and that urgency to occur. So the gut immune brain axis, when we calm down the inflammatory signaling in the gut, we're going to calm down the signaling to the enteric nervous system of the brain and vice versa. And, I still love this. I have to put this picture up because, when you think about it, back when I went to kindergarten in 1964, I was in kindergarten 1964. Uh, we didn't have to worry about peanut butter. You didn't have people reacting. In fact, I used to take peanut butter ho-hos in and pass them around. I was the man. Now, if you take peanut butter into a school, I mean, you could be facing detention or something. I mean, it's kids are more reactive. Adults are more reactive. Why? Because we've destroyed the gut immune brain interface and our immunologic capacity. And obviously, what we're looking for is a repair of this intestinal mucosa in the villi, as well as the lamina propria, which is the basement membrane, right? And it consists of a variety of different, immune cells. So when you think of it, what you're trying to do is make sure you're making plenty of mucin. And when we're not getting in resistant starch, less than 10% of people in the US get adequate fiber in their diet. And we're worried about giving them Tibetan goji berries and cat's claw and the latest detox for their gut. And we don't even get them enough fiber to help their microflora make adequate mucin to protect the epithelial cells of the intestine. So, gem number 2, make sure people are getting 30 to 40 grams of fiber in a day. And I think you'll find your people that, are failing on their elemental diets. A lot of times it's because they're not getting adequate resistant starch, and which has a tremendous impact on how you're going to rebuild the gut. And of course, this whole gut tissue is, there, and it's why you'll see IgA measurements or looking at secretory IgA when you're doing salivary testing, because we're looking at, how activated is that secretory IgA against antigens. And then, of course, what we really like to look at is, where are the lymphocytes at? So when you begin to think about the lymphocytes, when you got an increased amount of lymphocytes that are in the tissue, you're reacting to foods. So what are the results of a dysbiotic gut? Just kind of going through a lot of this. Obviously, the obvious one of reacting to foods and feeling that, right? Foggy headed, muscle aches, those kind of things, fatigue, increased sleep and mood disturbances, joint aches, connective tissue, inability to exercise at a high level. I mean, I have people that, they shut down quicker because, remember, as you start to disrupt your glucose regulation and now you're making lactate and pyruvate at a much higher level, you load up on lactate and pyruvate and you lose your performance capacity much quicker. Obviously, as we create more inflammation and the enteric nervous system is upregulated and we're making more circulating lipopolysaccharide, that triggers the microglial cells of the brain to activate more oxidative burden, which then kills off neurons and triggers inflammatory signaling in the brain. And people feel like they're pushing a thought through jello, right? I can't think clearly. I feel like my brain shuts off at 2 o'clock, right? And then, of course, other issues can occur: thyroid imbalances, thyroid autoimmunity, and remember, even because we're seeing more and more autoimmune thyroid, right? Lipopolysaccharide is the big offending compound for that. So when the gut lining is breaking down because you're, hypertensive, insulin resistant, not enough blood flow, or I'm eating a highly fat diet, like a ketogenic diet, over a long period of time, induces more circulating endotoxin. So any of those things can start to trigger that elevated lipopolysaccharide, which then, of course, leads to things like diabetes and insulin resistance and autoimmune thyroid. So you've got all the other things here that this is, that can also cause it: immune issues, cardiometabolic issues, of course, as we inflammation affects the epithelial cell, it's going to affect the endothelial cells, right? The 3 surfaces that are one cell layer thick: the brain, right? So the blood-brain barrier, the endothelium, and now the epithelium or the epithelial cells of the intestine, 1 cell layer thick, keeping us competent and whole. And, so we've kind of talked about what the different aspects are that affect the gut immune dysregulation: stress, diet, alcohol. I mean, I can tell you now, more and more people are training too much. I have people in their 40s and 50s and 60s, with a 20-year-old trainer trying to do professional athlete workouts. And it's our nervous system that breaks it down, guys. Just so you understand, the difference between a pro athlete and someone that looks like they could be a pro athlete is their nervous system is more efficient. They're able to tolerate more allostatic load before they start to trigger these immunologic and hormonal shifts. So when it's the everyday, John and Mary walking into the gym and the trainer's training them like they're, going to be going out for some professional team, you better make sure that they have adequate recovery. Hence the value of, heart rate variability and recovery measurements with your various devices, wearable devices, right? Using wearable devices and helping people understand readiness to train is actually saving their immune system and helping them with their longevity. So we went kind of through this already. Stress causes changes in, gut motility, permeability, mucosal secretion. When you get stressed out, you get more dysbiosis. When you're in balance, you have a better chance at normal gut microbiota. So how do you know if you're out of balance? Real simple. You have heart rate in the 70s, more than likely a person's sympathetic dominant. If their blood pressure is slightly high, most likely sympathetic dominant. If their heart rate recovery after an exercise is less than 24 beats in 2 minutes, they probably have some sympathetic dominance, which means that that gut is out of coherence, and that's going to trigger pro-inflammatory chemistry. So if you think of this, we have stress, hypothalamus, which affects the spinal cord. So here's kind of, if you look at, how the enteric nervous system ends up playing out, guys, here's a circuit board, right? Think of yourself as a big circuit board and you got circuit breaker boxes. The stress can be anything: psychogenic, physical burden, drug, environmental burden, you name it, right? Stress will have a direct effect. The hypothalamus hits the pituitary, causes the adrenal gland to release more cortisol. Cortisol causes the hypothalamus to trigger more excitation, right? Here's the direct effect. And this is that allostatic load piece that can occur. You also get cortisol being released into the gut, which triggers more permeability, so we get a bowel permeability directly from cortisol and then creating an increase in antigen presentation. Remember, at the very beginning, I started out with antigen presenting cells getting information because of a change in permeability of the gut. Now, you also have the hypothalamus giving the sympathetic nervous system upregulation via the spinal cord, then telling the anachromaffin cells of the enteric nervous system, hey, time to wake up, release more peripheral corticotropin releasing hormone. What's that do? So when I have peripheral corticotropin releasing hormone upregulated, I upregulate my mast cells. The mast cells, of course, trigger permeability. And then mast cells also have a direct effect on inflammation signaling and immune activation. So you see, this is a vicious cycle. I have to work it from both ends. I got to make sure I'm calming someone's nervous system down, getting them more in balance, teaching them how to do box breathing, getting that parasympathetic tone back, getting phospholipids in, build that acetylcholine, get the anxiety down while I'm working on their gut. Incredibly important to think of it from that perspective, because a lot of times just a simple food allergy elimination diet, sometimes if you catch them early on, it works. A lot of times it doesn't. It's that forever revolving door of testing and testing. And of course, this was a 2020 paper in the International Journal of Molecular Science where we look at that vagus nerve. So vagal tone, heart rate variability, right? The autonomic nervous system, the enteric nervous system, the HPA axis, all being driven by the vagal tone. What happened during the pandemic? People lost vagal tone. They developed syncope, right? And what else did they develop? A lot of dysbiosis, a lot of folks with COVID diarrhea, right? Think of how that played out. And the intersection of that is the communication between the gut and the brain. And then the byproduct of that is changes in immune function, endocrine function, and neural function. So neuropathies, immunopathies, adolescent T killer cells, T cell senescence, right? Changes in hormones, hair falling out, right? All kinds of things going on. So when you think of, what we're really doing when we're thinking of why is food allergy testing so important, it's because you're trying to balance this out. You're trying to balance the immune system's innate and acquired immunity and their repair cycle and cell-to-cell communication. You're trying to work on the gut and keep that epithelial layer intact. And realize that, the gut's involved in an initial transformation of biochemicals. and then realize that there's this, it's a significant structural defense in our body. And of course, the brain goes without saying: central control of physiology, mood, emotions, cognition, all of those are important. But what starts to happen? We get dysbiosis, we get permeability, we get intraepithelial accumulation for lymphocytes, we get upregulated antigen presenting, and is the net response of the guys. I have all this and all these influences on trigger, ultimately leading to malnutrition, leading to dysbiosis, toxin overload, which then creates an elevated toxin engine, which then of course drives systemic disease. So this is the model I've used for the last 30, working on patients. What are the influences on the left? How do I get that inflammatory response in the middle when you can't get by without getting people off of foods that are reacting all the time? And why not have a food panel that gives you IgG, IgG4, C3BD, and IgE? And of course, this is kind of things that start to go, really start to react. So look at the gut, AST, ALT, histamine typically goes up before it goes down. Low diamond oxidant, beta 2 microglobulin for the brain, depressed melanocyte stimulating hormone, which we find, of course, characteristic in the biotoxin exposed individuals. Neurotransmitter alterations. We start to see upregulation of the inflammatory cytokine process. No countermeasure to that, and then IgG, IgE, C3, BD, actin. So we kind of went through this already. Just remember, when lymphocytes are high in the epithelial cells, it damages your tight junctions. So when you react to things, you're going to damage those tight junctions. And that's why you see a lot of people progress with their food allergies, because they get more and more reactive, and they get more and more reactive to more foods because their gut gets leakier and leakier, or to be correct, more permeable and more permeable. And this slide is just about that for the sake of time. And then just keep in mind that this whole aspect of these HLA folks, so your folks that are, HLA positive, if you're testing the DR series or DB series, you realize that, oh yes, people that are, HLA positive, more prone for autoimmunity. Well, guess what? If they're HLA positive, they're prone for autoimmunity. They get an exposure to a biotoxin like mold or Lyme or another, bug, and their gut is primed for developing food allergens. And why not take those foods away to help calm it down as you're working through those deeper seated and deep rooted problems? And this is just kind of the balance of immunity, right? You got the B cell antibodies on the right. This is that Th2 activation where you see all the IgG activation. And then, of course, the Th1, which we're looking for. And this is just really the issue here is that when we have unfriendly flora in a poor tight junction, we upregulate inflammatory cytokines. We prevent vitamins from being utilized in the gut. We reduce butyrate regulation or butyrate utilization. And the dendritic cells, we've kind of went through this a little bit already. Just remember that your friendly flora help to reduce the food antigens effect on gut permeability. So why probiotics? Why resistant starch? You're trying to reduce the reactivity to rebuild the competency of the gut lining. There's a lot of drugs that disrupt the microbiome. I had to bring this up to you. I've got an ebook on this. If you guys, I can send it in for Avexia to distribute if you guys want. But I wrote one on drug-induced microbiome disruption. It's thought that 24% or more of the drugs that we take disrupt the microbiome. And it's not just antibiotics, guys. Look, metformin, statins, antipsychotics, opioids, PPIs, oral contraceptives, right? So there's a lot of medications you're swimming upstream against that you got to work even harder to get the gut competence. They're not reacting to foods. This whole aspect of antibiotics and yeast production. When we get a lot of candida, we start to make acetaldehyde. Why is that such a problem? Because acetaldehyde ends up causing inflammation in the liver. and it can also travel up into the brain, the spinal cord, muscle, and as well as the liver. And what happens is that we lose our acetaldehyde enzymes that help to break it down. And then we start to, when you see here, acetaldehyde reacts with dopamine to create aldosterone, reacts with serotonin to form beta-carboline. Those are phenols, and that's why spectrum children a lot of times will be reactive to phenols because of their elevation in acetaldehyde and their regulation and making of phenols in the brain instead of the neurotransmitters dopamine and serotonin. And of course, where is this a real issue? Chemical sensitivities, headaches, foggy headedness, impaired memory, all of this relates to acetaldehyde. Remember, if you are making a lot of acetaldehyde and you got that acidotic breath, that kind of aldehyde type breath, or you have a lot of yeast or candida, they've got thrush, their gut's getting broken down. It's happening. So we've got to figure out what foods are they reactive to, get them off of them. Obviously, you got to starve the candida. I mean, candida diets have been out forever. And the next piece to this is lipopolysaccharide, right? So acetaldehyde, regulation of that, important in order to keep gut integrity intact. Obviously, the overarching pattern of this is getting rid of sensitive foods. And then lipopolysaccharide, of course, is the compound endotoxin that gets released from a bacteria when it dies off. And this can occur from stress, from an extended ketogenic diet, drugs, overtraining, binge drinking, poor food choices, insulin resistance, high blood pressure. And why is it important? Because it triggers autoimmune activation, and it triggers TNF alpha and IL-6, which and of course will trigger a leaky gut. And when we look at people with weight gain, lipopolysaccharide has been directly associated with people that are obese. It triggers gliosis in the brain. The gliosis in the brain creates more permeability, and now that lipopolysaccharide can circulate systemically and then attach to organs and tissues and trigger inflammatory signaling.
And of course, when we get under.
And so what do we do? What else do we need to know? You guys were right. I had more slides in here than I thought I did. This is great. What's the next piece you need to understand? Well, there's trimethylamine oxide or oxidase, or TMAO, which happens when we're what? It's a bacterial metabolite. It's a marker for gut permeability. It's prognostic for cardiomyopathy patients. But what happens is when people are eating lots of carnitine containing foods, the TMA gets converted to TMAO, which actually promotes atherosclerosis and inflammatory chemistry. So why clean up the gut? Because we're trying to clean up. So prebiotics, probiotics, plant forward diet, moderate intakes of proteins, so that we reduce this TMAO. And you can measure TMAO as well. And then of course, for food sensitivities, and we have a lot more to cover, guys. I've got this broken out of a series. I hope you join me for the other talks. Test for IgE, IgG, and IgG4 as well as the complement, because people are so inflammatory now. And everyone's interested in longevity. Everyone's interested in keeping those bad senescent zombie cells away. Well, guess what? We have to keep the fires of inflammation down in the body. 70% of the immune system's in your gut. We are now expanding our knowledge of that gut sensitivity and the role of IgG4 complement IgG, and it's important as a major component of how you're going to help people well. There's a lot of studies that support the gut microbiome, of course, and test annually because people's guts change. They're with age, with diet, with stress, with exposures, with the level of physical activity, maybe prescriptions they've been on, weight control issues. Any of things affect the microbiome, and when you affect the microbiome, you're going to affect the integrity of the gut and have potential food intolerances. Now, I'm going to go over just for a minute zonulin, because it's really important that we understand that with zonulin, of course, the higher the zonulin, the more gut gets leaky. This has been known for a while. and that zonulin controls your nutrition, and that when you eat things like, gliadins or gluten, it triggers zonulin receptor zones, which then open up the junctions. And of course, so you hear that even people that are just gluten sensitive develop, tight junction problems, even if they don't have celiac, of course, and create a lot of autoimmune consequences. So obviously, when you look to the left, a stable gut microbiota, you have controlled antigen trafficking, you have tight junctions. When you look at gut dysbiosis, you get, meaning I've got bugs that are unfriendly, that stress will upregulate it. I start to lose that trafficking in the tight junctions, and now I have an increased signaling of inflammatory cytokines and T cell activation and loss of tolerance. Look at the metabolic inflammatory conditions associated with increased zonulin. Insulin resistance, irritable bowel, hyperlipidemia, depressive disorders, celiac, chronic fatigue, colitis. This is a 2020 paper that just was published by, of course, Dr. Fasano, right? So pretty important that we start to think about this whole aspect of testing you can do with infant allergy labs. And this is just kind of the last piece I want to go through is just really quick, guys. Please look at if you look at the breakdown of histamine, you see aldehyde as well. Histamine is here in the middle. This is histamine. Down. If I have exhausted this and have elevated acetaldehyde, I can't break it. And so people with yeast tend to be more histaminic, right? But and they're red and they're graphic and they get allergies and they get skin rashes because they can't. Why is this so? Can't break down. Important because if we go to here, histamine's involved in everything from hypotonia to vertigo to headaches to nausea to arrhythmias, the obvious urticarias and skin stuff and bronchoconstriction, but dysmenorrhea, diarrhea, right? So histamine, zonulin, food allergies. Keep them all. Infinite Allergy Labs tests for all of them. And they're all important factors to go with it. And I'm going to end here because we're going to have a lot more information to go over. I know we got a question and answer, but I do believe there's some slides here at the end. Go over how to order infinite allergy labs. I'm going to stop here.
Yes. So if you proceed to slide,
take control.
Yeah. So let me.
And I'll be glad to answer questions.
Our first question is from Janelle Kaplan, who says, for individuals with co-occurring high IgE and high IgG4 for a particular food, is there any risk that eliminating the food trigger will increase the risk for anaphylaxis upon reintroduction? If so, would a rotation diet be a better approach?
Now, if it's IgE and IgG4, you want to eliminate it for a period of time. That's pretty straightforward. However, what you would do is you would probably work on reducing the mast cell. So if you remember how those mast cells are getting upregulated, so is the person under a lot of stress, get the gut flora right, maybe, give them some quercetin, or if you're using things like peptides, you could use BPC 157, which downregulates TNF alpha in the gut, or KPV. You could use the diamond oxidase to do that. So typically, if they're high in IgE and IgG4, you want to try and correct the gut and eliminate the food.
Let me see. Any other questions? Just please submit them in the questions section there. Just give us everyone a second. Okay. No? Okay, so I guess we'll proceed on to going over some features that Avexia offers. Ask the Doctor, which we have our Dr. Sedano online here. It's a free service for all Avexia clients. You have access to Dr. Sedano, who will review test results, clinical conditions further, and he'll provide further test recommendations or answer any questions you have about testing. That is a free service. You just log in, go to the quick links on the left side of the dashboard. There's an Ask the Doctor banner. You click on it, you then submit your test results, ask your questions. He'll get back to you, usually within a day. And there's also a for another small fee, a live consultation across Zoom or video conference. So that's always available. Let's see here. And then how to order the test, log in to your Avexia account and click on Avexia link. Then you select a patient or create a new patient, add a new lab order, select specialty testing, add infinite allergy products is the tab you want to click. Add the test that you want with the blue plus symbol, and then preview your order, and you're off and you've placed your order. To learn more about Avexia Diagnostics, we have our client success team is available on extended office hours Monday through Friday, 8 a.m. to 8 p.m. Eastern at 888-852-2723. We have a live chat option as well, or email us at info@avexiadiagnostics.com. And I would just like to thank everyone from Infinite Allergies and Avexia Diagnostics for attending this evening. We wish you the best on your pathway to wellness. Thank you, Dr. LaValle and Dr. Sedano, for this wonderful presentation.
Thank you all. Have a good evening.
Have a good evening.